Hey there, health enthusiasts. Ever felt a weird bump behind your knee, like a little water balloon hiding under your skin? Don't worry, it might not be as scary as it sounds. Today we're tackling a common knee nuisance, especially for our awesome seniors bakers cysts. Think of it as a little pouch filled with fluid, chilling out behind your knee. It's like a little balloon animal your knee made. But unlike those fun party favors, this one can be a real pain, literally. Don't worry, we'll break down this mystery together. We'll learn what causes these pesky pouches and how to deal with them. So, grab your knee brace and let's get started. Let's get down to business. What exactly is a baker's cyst? Imagine your knee joint as a well-oiled machine. It needs fluid to move smoothly, right? Now sometimes this fluid decides to play hooky and escapes to the back of your knee, forming a cyst. Sneaky little fella. It's like when you overfill a water balloon and a little part starts to bulge out. That bulge is our baker's cyst. And just like that overfilled balloon, it can be uncomfortable and even painful. But don't fret. Most of the time, these cysts are harmless and disappear on their own. However, if they decide to overstay their welcome, we have ways to show them the exit. Now, why do these cysts choose our knees as their vacation spot, especially as we age gracefully? Well, one word: arthritis. Arthritis is a common condition that affects millions of people worldwide, particularly as they get older. It causes the cartilage in the joints to break down, leading to pain, swelling, and stiffness. This is particularly true for weight-bearing joints like the knees, which endure a lot of stress over the years. As we get older, our joints, especially our knees, can get a little worn out. This wear and tear is a natural part of aging, but it can be exacerbated by factors such as obesity, previous injuries, and even genetics. When the cartilage wears away, the bones in the joint can rub against each other, causing pain and inflammation. This wear and tear can lead to inflammation and extra fluid, setting the stage for Baker's cysts. The body produces this extra fluid in an attempt to protect the joint, but sometimes it can accumulate and form a cyst. These cysts can cause additional discomfort and limit mobility, making it difficult to perform everyday activities. Think of it like this: your knee is like a car. Just as a car's parts can wear out over time, so too can the components of your knee. Regular maintenance and care are essential to keep both running smoothly. Without proper attention, small issues can turn into bigger problems, leading to more significant damage and discomfort. The older it gets, the more likely it is to have a few squeaks and leaks. These squeaks and leaks in your knee can manifest as pain, swelling, and reduced range of motion. It's important to listen to your body and address these issues early on to prevent further complications. And sometimes those leaks lead to Baker's cysts. These cysts are essentially pockets of fluid that form behind the knee, causing a bulge and a feeling of tightness. They can vary in size and may even fluctuate, sometimes becoming more noticeable after physical activity. Other culprits include injuries, overuse, and even some medical conditions. Injuries such as meniscus, tears, or ligament damage can lead to the development of Baker's cysts. Overuse from repetitive activities or sports can also contribute to their formation. Additionally, medical conditions like rheumatoid arthritis or gout can increase the risk of developing these cysts. But fear not, we'll equip you with the knowledge to combat these knee invaders. Understanding the causes and risk factors is the first step in managing and preventing Baker's cysts. There are various treatment options available, ranging from lifestyle changes and physical therapy to medications and, in some cases, surgery.
Hey, it's me, Arthritis Andy. I'm here to give you the lowdown on what's happening inside those knees of yours. I'm here to cause a bit of trouble, but I'm also here to help you understand how to keep me at bay. By staying informed and proactive, you can manage the symptoms and maintain a good quality of life, and make those knees squeak and creak. But don't worry, there are ways to keep me in check. Regular exercise, maintaining a healthy weight, and following your doctor's advice can all help reduce the impact of arthritis and prevent the formation of Baker's cysts. With the right approach, you can manage your symptoms and continue to enjoy an active and fulfilling life. So let's get started on this journey to healthier knees together.
So, how do you know if you have a Baker's cyst setting up camp behind your knee? Well, it's not always obvious at first. You might start to notice a few subtle signs that something is amiss. One of the first clues could be that your knee might start singing the Baker's cyst blues. This means you could experience a dull ache or a feeling of tightness behind your knee. You might feel a soft bulge behind your knee like a little water balloon. This bulge is actually a fluid-filled sac that forms when excess joint fluid is pushed into the back of the knee. Sometimes it's just a little bump, but other times it can be as big as a golf ball. The size of the cyst can vary greatly, and it might even change from day to day. Your knee might feel stiff, swollen, or even painful, especially after exercise or standing for a long time. This discomfort can make it difficult to move your knee fully, and you might find yourself avoiding certain activities. It's like your knee is saying, "Hey, something's not quite right here." This persistent feeling of discomfort is your body's way of telling you that it needs some attention. If your knee starts throwing a full-blown party back there with redness, warmth, or if the pain is really intense, it's time to call for backup. These symptoms could indicate that the cyst is causing more serious issues such as an infection or a rupture. Your doctor will know just what to do. They might perform a physical examination, order imaging tests like an ultrasound or MRI, and discuss treatment options with you. Treatment could range from simple rest and ice to more advanced interventions like draining the cyst or even surgery in severe cases. So if your knee starts singing the Baker's cyst blues, don't ignore it. Listen to your body and seek medical advice to get back on track.
Don't worry, folks. We're not going to leave you hanging with a grumpy knee. Here are some home remedies to tame that Baker's cyst and keep your knee happy. Whether you're dealing with a bit of discomfort or more persistent pain, these tips can help you find relief and get back to your daily activities with a smile. So let's dive in and explore some simple yet effective ways to care for your knee right at home.
Rest is best. Give your knee a break. Avoid activities that make the pain worse. Think of it as a little vacation for your knee. When you rest, you allow your body to heal naturally. This means avoiding strenuous activities like running, jumping, or even standing for long periods. Instead, find a comfortable spot to sit or lie down, and let your knee relax. You can still stay active by doing gentle exercises that don't put too much strain on your knee, like swimming or cycling. Remember, rest doesn't mean complete inactivity. It just means being mindful of how much pressure you're putting on your knee.
Ice baby. Apply a cold compress to the area for 15 to 20 minutes at a time, several times a day. It's like a mini ice bath for your knee. The cold helps reduce inflammation and numbs the area, providing relief from pain. You can use an ice pack, a bag of frozen peas, or even a cold, damp towel. Just make sure to wrap the ice pack in a cloth to protect your skin. Consistency is key here, so try to make it a part of your daily routine. And remember, never apply ice directly to your skin as it can cause frostbite.
Compression is key. Wrap your knee with an elastic bandage to reduce swelling. It's like giving your knee a warm hug. Compression helps to limit the movement of the knee, which can prevent further injury and reduce swelling. When wrapping your knee, start from the bottom and work your way up, making sure the bandage is snug but not too tight. You should be able to slip a finger under the bandage. If you feel any numbness or tingling, loosen the bandage immediately. Compression can be especially helpful if you need to be on your feet for a while, as it provides extra support.
Elevate to celebrate. Prop up your leg on a pillow to reduce swelling. Let gravity do its magic. Elevating your leg helps to reduce the flow of blood to the affected area, which can decrease swelling and pain. Try to keep your knee elevated above the level of your heart for the best results. You can do this while resting on the couch, lying in bed, or even sitting in a recliner. Just make sure your leg is well supported and comfortable. Elevation is a simple yet effective way to give your knee a break and promote healing.
Remember, these tips can help manage the symptoms. But if the pain persists, it's time to call the doctor. Persistent pain could be a sign of a more serious issue that needs professional attention. Don't hesitate to reach out to a healthcare provider if you're not seeing improvement. They can offer additional treatments, such as physical therapy, medications, or even surgery if necessary. Your health and well-being are important, so make sure to listen to your body and seek help when needed. Taking care of your knee now can prevent more serious problems down the road, so don't delay in getting the care you need.
While most Baker's cysts are as harmless as a kitten, sometimes they need a bit more than just home remedies. If you experience any of these red flags, it's time to call in the big guns, your doctor.
Severe pain or swelling that doesn't improve with home care.
Redness or warmth around the cyst.
Difficulty bending your knee or walking.
Signs of infection such as fever or chills.
Remember, it's always better to be safe than sorry. Your doctor can properly diagnose the issue and recommend the best course of treatment. So there you have it, folks. The mystery of the Baker's cyst, unwrapped. Remember, these fluid-filled pouches are common, especially as we get older, and often harmless. But if they start acting up, don't hesitate to seek professional help. Take care of your knees and they'll take care of you. And remember, a little humor goes a long way in managing any health concern. The information provided in this article is intended for general knowledge and informational purposes only, and does not constitute medical advice. It is essential to consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment.